Obviously, I'm sorry that I'm going to ask about something other than what the topic is today, as much as green energy is fantastic. COVID in schools is something that is gathering most people's attention right now. I know that you have taken a hands-off approach and you have left health to deal with most of this, but we are seeing percentage of cases in children, especially children under 10, increasing. It's gone from 8 to 10% earlier this month to 10 to 20% now. And I'm just wondering, when is the time that you might step in, at least for optics, to do more, to ensure there are masks in school, to do more safety so that parents feel safe sending their kids to school until they can vaccinate them?
Thank you, Lisa, for the question. And just at the outset, I want to say that I have worked hand in hand with Dr. Henry and Minister Dix from the beginning of the pandemic. We made the choice to have Dr. Henry be the primary communicator because there was no need for translation. I think British Columbians want to hear directly from public health officials on how we collectively need to manage our affairs under COVID-19. And I do acknowledge also that there is anxiety in the schools. There's anxiety in communities, as we've seen persistently high case counts when we had anticipated at this point, with over 80% of British Columbians double vaccinated and almost 88, heading to 89% with a single dose, we had anticipated that the modeling predicted that the case count would start to come down. And we said back in May when we launched our four-step plan that it would be guided by the data. As it came to us, we would amend our plans and respond accordingly. And that's exactly what we've done. Dr. Henry and Minister Dix will be available in a few short hours to expand on where we are today and where we need to go. But I want to assure all British Columbians that we have worked on this collectively as a cabinet and working with public health and the health authorities to make sure we're protecting people, we're not seeing a surge in our healthcare system, and our economy keeps moving.
Lisa, do you have a follow-up?
Talking, Premier, about the number of cases we're seeing now, despite the number of vaccinations that there are, the percentage of vaccinations that are in the province, I'm just wondering, I don't know, does it feel like a failure? There's a lot of criticism coming your way for moves that people think should be made, information that people think should be provided, and steps people think should be taken that haven't been. And so I'm wondering, does it feel like a failure? How does it feel to see that we're at this state, a year and a half into this, past a year and a half into this?
Well, we have been responding every day to changing circumstances. We've had variants of concern, as we've discussed with you and your station and all media for the past number of months. We have a particularly virulent strain today that is transmissible largely through those that have not yet been vaccinated. We have a pandemic of the unvaccinated at the present time, which includes those under 12, and we need to be conscious of that. Dr. Henry is very well aware of that. We have been working with stakeholders within the K-12 system to try and ensure that we reduce anxiety for parents, reduce anxiety for children, and also keep them where they are safest, which is in our classrooms. That will perhaps mean more changes, and I'll leave that to Dr. Henry to lay them out for you in the context with which I think British Columbians want to hear about this. But I don't believe that there's any reason to talk about success or failure. What we need to do is continue to bear down, as we have been doing collectively for the past 19 months, and together we'll get through this. And if you have a friend who's not vaccinated, encourage them to do so. If you have a family member who's waiting for more data, tell them to look at those who are pleading with their family members to get vaccinated from ICU beds, not just here in British Columbia, but indeed around the world.